Okay, so this question has been transferred to your final exam.
What's the question?
Adenosine is a drug we can't administer it. It'll be the doctor who administers this, but it's used to terminate certain arrhythmias, certain high heart rate arrhythmias, tachyarrhythmias. Examples are a flutter, or the most common indication is SVT, supraventricular tachycardia. Now, adenosine is the only FDA-approved drug to terminate those types of dysrhythmias, but you need to prepare because this is done fast, okay? So what do you need to have at the bedside when the doctor says, okay, let's prepare adenosine? This is in the crash cart. It comes in a 6 milligram dose. So it's a tiny little vial, 1 ml vial, 6 milligrams. But since it can be repeated to 12, you can give 12 milligrams as after 3 to 5 minutes if the patient doesn't respond. So there'll be like 5 or 6 of these in the crash cart. Okay. So when it's 6 milligrams, you know you're gonna grab one. Okay, hand it to the doctor with this syringe, of course. Now, what you need when you administer this is 1 flush. Oh, no, sorry, 2 flushes. Okay, because there's no 20 ml flush. Flushes come in 10 ml only. So you give them 2, and you need a 3-way stopcock. Okay. Okay. So this is a 3-way adapter. You know what? Let me show you YouTube video.
Every time.
Okay, so the YouTube won't be recorded, but I'll show you the video here. Okay.
Emphasize the academic expertise.
Okay, so watch the video. So the nurse or the doctor here prepares the 6 milligram dose. So no, this one, no need to dilute. Okay, so they'll attach. So this is your lower lock. This is your hep lock, patient's IV access. They attach an adapter, which is a 3-way stopcock. They attach a flush on one, because when it says 3-way, then you can administer 3 different syringes. Okay, so they're just gonna use 2 though. So one will have the medication, the other will be a flush. So this is the flush, and here is the adenosine. You follow so far?
Yeah.
Okay. So that's it. Okay, so this is the flush right there, and this is the medication. All right. Now, what they'll do is, because the drug only has a 10-second half-life, 10 seconds. So therefore, we need to get that drug into the patient's heart as quickly as possible. It won't work if you have no 3-way stopcock, meaning if you have, because how long does it take to connect and then disconnect a syringe? Takes 2 seconds, right? So therefore, you'll never make it, right? So the drug will be ineffective if we do it that way. So that's why the only way to give this is you need a 3-way stopcock. Okay, so just FYI, that's what you need. So hand the doctor the drug, you have to have the 3-way stopcock, okay? And then there has to be 2 flushes. Now, why 2 flushes? Because how long was the extension tubing again? How much does the extension tubing on our IV access hold? 0.5 milliliter. And the drug is only 1 ml. So therefore, when you flush it, where's the drug? When you push it, where's the drug? Half of it went into the vein. Where's the other half? In the extension tubing. Okay, do you understand what I'm saying? Okay. Right, and then you have to flush it fast, okay? So that the drug is pushed straight into the heart and makes it there before the 10 seconds. Okay, again, 10 seconds, the drug's gone. All right, okay. So here's the, and then watch the monitor, watch the patient's heart rate. Okay, so now you turn it on, that way all are open. Okay, all ports. This one's open, this one is open. Okay, so that's what you do when you turn this. See, it says all open. Okay, so watch the. Okay, so what she's saying is she puts pressure on this plunger because of course all are open. This is open, this is open, that is open. So when she pushes and she doesn't put pressure here, where's this drug gonna go? It's gonna go into the flush. We want it to go here, all right, into the patient's vein. Okay, so, okay, time it, okay, how many seconds it takes? Okay, 1.5, and that's about what, 4 seconds? Okay, so watch the heart rate. So it was 178. Look at what happens. Okay, so let me, in case you missed it. All right, so look at the heart rhythm. Very fast, yeah? So this is SVT, okay? Or it could also be sinus tach. Sinus tach or SVT, they're like identical, okay? Look at what happened. It stopped the heartbeat, yeah? So the patient went into a systole for a moment, okay? So let's see how long it lasted. There. So the patient goes into a systole for about 3 to 4 seconds. Okay, that is expected. Totally expected. Okay, so it will stop the heartbeat, puts the patient into a systole. Now it will reset shortly. Okay, so a few seconds later, there we go. Look at that sinus. Okay, so now the patient is back to normal sinus rhythm.
It's like a chemical cardioversion.
Yeah, this is a type of no. This is not cardioversion. Cardioversion, chemical cardioversion is flecainamide, dionederone. So those are your chemical cardioversion. This is not. Plus, we only cardiovert what? A-flood or A-fib. Okay, this is SVT. So what we're trying to do is lower the heart rate. Okay. And there we go. Okay, so the patient is now back to sinus rate is now 91. But what happened again after the drug is given? Okay, so we expect the patient to go into about 3 seconds of asystole, okay, and then it goes back. Now, can it stay asystole? It's possible, okay? I've never seen it, but it's possible. So therefore, when we do this procedure, what do we have to have at the bedside? We have to have emergency crash cart, okay? Just in case something goes wrong. If it doesn't work after 6 milligrams, you can repeat with 12.
After how long? Wait, repeat with
Every 3 to 5 minutes.
So
Yes.
another 6 or 12?
12 this time.
Okay, that's
Yes.
what I asked. So every 3 to
All right.
5 minutes.
Yeah, I mean, you don't want this drug lasting more than a few seconds, right? I mean, imagine what it will do to your heart rate. So if it lasts more than 10 seconds, then probably stop your heartbeat permanently. Okay. All right, that's about all I wanted to add for that.